Welcome to the NHS Data and E-commerce Systems for Healthcare Providers. I'm just grabbing my tea here. Grab yourself a cup of tea. So, this is episode 15, Build Your CEO Muscles. And I'm going to talk to you today about how to use NHS data and e-commerce systems for your healthcare business. And this is for healthcare providers. I'm going to talk to you about why and that the global large organizations are using this method to actually be ahead of the game, to be ahead of the time, and to also offer the best possible outcomes for patients and those that use the service. So I want you to also start thinking about this. If you haven't done so already, you need to really understand this in order for you to work with the organizations that you want to work with for now, as well as in the future. Okay, so we're going to get on with this training. So listen up carefully, all of you. So the NHS data and e-commerce systems for healthcare providers. It's about looking at these systems in place where you can look at different aspects so that you're able to provide a better service in your healthcare business where you are. First of all, you've got your paperwork. Second of all, you've got your recruitment software and you've got your systems in place. So this is all part of your people. All of these, you need to think about the cloud. You need to think about the organizations that you're going to be working with. There's all these different systems that you need to have in place in order for things to work out smoothly and effectively. What I want to talk to you about is how you as an organization, how to effectively utilize NHS data to drive innovation and improve patient outcomes. That's one of the things that I want to talk to you about today. Secondly, I'll be talking about the role of e-commerce systems in streamlining healthcare services and operations. Thirdly, I will be discussing how you would integrate your data-driven solutions and e-commerce platforms in the healthcare ecosystem. Furthermore, I will be discussing with you future trends and opportunities in the intersection of healthcare data and e-commerce as well. So, the utilization of NHS data has the potential to significantly improve the patient's outcomes as well as service users' outcomes. This is by enabling care providers to identify patterns and trends in patient health and to develop targeted interventions and treatments based on this information. So, like for me, example, I was speaking with someone earlier. You can look at what area of need is in your location, what the need is high pressured, what the need is for you to provide that service to that organization, for example, by looking at also data and what the patterns are that they have identified to be needed for you to be able to provide that service. So, assessing care needs information to provide services to the NHS and or give government, for example. You need to look at what that need is. Is that need a high need? Is it specialisms? Is it community? Is it cultural need in the locality where you want to serve? And what is that need? And look at matching that need with the services that you are able to provide. You want to look at identifying specific care needs required by the NHS or the government or any organizations that you are looking to work for. If you are a global organization, then look at what the area of need is globally for example, if it's America, then you would look at what that need is with that government organization. The same with the UK. Okay, so this may need you to do some research on current healthcare trends and initiatives that are currently out there at the moment. You'll be looking at reviewing government policies and their guidelines and consulting with healthcare professionals like yourselves, as well as those that you wanted to do the work with. So think about who it is that you want to work with, create a list and what organizations you're going to be approaching. But first of all, find out what that need is in that locality by doing your research. There'll be data out there, especially with the government. There will be plenty of data out there for you to look and source and see for yourself. So you want to develop partnerships and collaborations, building partnerships and collaborations with relevant organizations, including NHS trusts, government agencies, and healthcare professionals can be helpful in assessing care needs information. These collaborations can provide valuable insight into specific needs of healthcare systems and may facilitate access to relevant data sources. This is what I'm showing you is what the large organizations are doing. And I want you to be able to do the same because you can be more fine-tuned, you can be more specialized than what they are because of what you are able to provide. You've got more flexibility, you can pivot and change direction so that you can provide that need immediately and fast. So it's a rapid response is what you want to be able to provide. Access and analyze the data. Once the data sources have been identified and appropriate partnerships have been established, data can be assessed and analyzed to gain insight into specific care needs. This may involve using data analysis, tools and techniques to analyze large data sets and identify trends and patterns. So think about it, get your notepad and paper, use your laptop, make notes, your iPad, make some notes about what I'm saying here today, because this is really valuable information that you can start implementing right now. So you want to develop a service plan, get a notepad and paper out, like I said, make some notes, because this is really going to help you to understand what I'm saying to you, because some of you may be hearing this for the very first time about this EIS system, okay? What is it can you do that you can provide that service to meet this need that the large companies are currently doing right now, okay? So develop a service plan. We cover this we've got the 3-day challenge coming up, but we've also got our membership side as well. We do cover this in greater depth. So based on the insights gained from the analysis of care needs data, you would have a service plan. It would be developed to address the specific needs of the NHS or the governments. This plan should be informed by the data and the insights that you've gained from the analysis and should include a clear goal with your objectives, as well as specific actions to be taken to meet the identified care needs. So like I said, you'll be sitting down, looking at that data once you've received it. What is the high pressured need? What is the need that they are really struggling to cover? What is the need that is causing them difficulties with the staffing situation, for example? Look at meeting that need. I'm really excited because we've got some software coming out that is related to this that you'll be able to have access to as well. So the implementation of the EOS, the Enterprise Operating System, is having a significant global impact on the healthcare industry. Healthcare organizations worldwide are leveraging the power of EOS to transform their business as well as achieve better patient and service user outcomes, for example. Implementing EOS in healthcare organizations require a comprehensive approach that involves several steps, including, and I'll just touch on this briefly, it includes the evaluation of organizations' hardware and software systems, as well as the IT support capabilities within the EOS. So the EOS is a comprehensive management system that integrates a range of functions and processes within your organization or within an organization. For healthcare providers, EOS can be customized to meet their unique needs, providing a platform to streamline operations and improve patient service user outcomes. Leading medical providers around the world are already adapting the AI-driven healthcare software to improve their operations and enhance patient care. This trend is expected to continue as healthcare providers, large and small, seek innovative solutions to reduce costs, improve efficiency, and provide better patient outcomes in an increasingly challenging healthcare landscape. So, like I said, today is going to be a short presentation today. So by using healthcare provider software, by using this software, it has the ability to improve efficiency by automating routine tasks and processes. This includes tasks such as appointment scheduling, patient triage, and data entry, freeing up healthcare professionals to focus on the more complex tasks and improving overall productivity. This is what the larger organizations are doing in order to work with NHS and government bodies as well. They want to know, what softwares are you using? What software do you have in place that is going to create this automation in order for them to know that you've got systems in place to help with the efficiency of running your healthcare business. So overall implementation. So the EOS system in a healthcare organization can improve operational efficiency, enhance collaboration, and enable better decision-making, leading to you having a better business model, as well as improved patient outcome and a more effective healthcare system. And this is one organization, for example, Millennium Center Sweden, they actually provide these types of systems which you can use and benefit from as a healthcare provider. But like I said, we will be going into greater depth with this in our 3-day challenge, which we've got coming up in May the 17th for 3 days. It will be 3 hours each day from 7 p.m. UK time to 10 p.m. UK time. I will be going into greater depth, which I will cover the EOS systems and what the healthcare providers are actually using this currently in the global market, as well as in the UK, as well as in the USA. It is massive. And in order for you to really look at the larger contracts, then you need to start putting these things in place once you've got the income to do this as well. So I will go, like I said, I'll go into greater depth of the EOS systems being used globally in our 3-day event. And I hope that you can join us because it is going to be amazing. So do register for our 3-day challenge event. It is, and my team will post the link for you to register in the Facebook group. There is a group page that it will go onto. So you need to register so that you go into the group page and we can, do some, things leading up to that event, some training, so we can start preparing you for this as well. So it's a 3-day challenge. In the Facebook page, the team are going to click the link, for example, so that you can register right now to attend the 3-day event, for example. So the comments, it should be in the comments so that you can see the register now link in the group page. So my team have just put a link there in the comments for you to do that. It's about launch, grow, and scale globally with EOS systems. Automate your healthcare business processes. It's so important that you start doing that now. We're in the metaverse, we're online so much. We need to really look at what that paradigm is and meet it now. Meet your future now, implement it now. Join us for the 3-day event. We are so looking forward to you being a part of this. We want to grow with you. We want you to grow with us. We want to help support you in your healthcare business. And I'm here to show you the programs and systems that people have put in place that is really working extremely well for them right now. And I just wanted to mention that to you. So click register. Who's registered so far for the event? Let's see some hands up. Have you registered? Say yes. Are you going to register? Say yes in the comments. Let's see, so my team can reach out to you just to make sure that you're able to register. Let us know if you're having any problems with the link that has been posted, but I've just checked it. It seems to be working fine. I just want to say thank you so much for being here today and taking time out. You'll be able to watch the replay. For those of you that's watching the replay, #replay. For those of you that's watching the live, #live. Give me some hearts, give me some love. Let me know that you've enjoyed today and that it's been very beneficial to you. Thank you so much, everyone. Like I said, today is a short one, but I hope it was informative for you. Like I said, #replay. Let us know that you are here, you are live, because I can't see, because it's all jumbled here. So I can't see the comments because it's like, it just goes into, because we've got quite a lot of comments, so I can't really see. So apologies for that, but I will try and reach out to you and comment like your comments, and my team will also reach out to you. Do book a free 15-minute consultation with us to discuss how you can grow and scale your healthcare organization globally. I am so happy to talk about that right now. And but we can also go into deep dive with this May the 17th to the 19th, 2023. We start at 7 p.m. We finish at 10 p.m. We are going to have some wonderful prizes for you. We've got free gifts for you. We'll also post in the link the one for the Zoom for those of you that want to join the live Zoom, where you can talk, chat with other members as well that are in the Zoom as well. I just want you to be informed and to be able to have the best healthcare business that you can grow and develop. And this is the whole point of me doing these trainings live for you to learn and scale and grow your healthcare business. So thank you so much. Link is in the comments for you to register. I hope you have a wonderful day. And I just want to say thank you so much. Today is a short one, but you know what? You're going to learn so much from this. Do register to join our event. Join our weekly lives, because we are always going to go live here weekly. Have a wonderful day. And I look forward to do more training with you as well. So thank you so much, everyone. Take care. Thank you. Goodbye.